Hey guys, welcome to Medifaction. Today we will learn about the anatomy of tympanic membrane. So, the tympanic membrane, also called as the eardrum, is a thin layer of tissue in the human ear that receives sound vibrations from the outer air and transmits them to the auditory ossicles, which are tiny bones in the tympanic cavity or the middle ear. So, to learn more about tympanic membrane, let's go deeper. In this video, I will be enumerating an introduction, structure of tympanic membrane, blood supply and venous drainage along with lymphatic drainage, the nerve supply and some important clinical anatomy. Introduction. The tympanic membrane is a thin, translucent partition between the external acoustic meatus and the middle ear. It is oval in shape, measuring 9 by 10 mm. It is placed obliquely at an angle of 55 degrees with the floor of the meatus. It faces downwards, forwards, and laterally. The membrane has outer and inner surface. The outer surface of the membrane is lined by thin skin. It is concave in nature. The inner surface provides attachment to the handle of the malleus, which extends up to its center. This right here is the malleus. The inner surface is convex. The point of maximum convexity lies at the tip of the handle of the malleus and it is called the umbo. So this right here is the tip of the malleus or the umbo. So the membrane is thickened at its circumference, which is fixed to the tympanic sulcus of the temporal bone on the tympanic plate. Superiorly, the sulcus is deficient. Here, the membrane is attached to the tympanic notch. From the ends of the notch, two bands, the anterior and posterior malleolar folds, are prolonged to the lateral process of the malleus. This right here is the short process of malleus. While the greater part of the tympanic membrane is tightly stretched and is therefore called the pars tensa. This right here is the stretched pars tensa. The part between the two malleolar folds is loose and is called pars flaccida. This is the pars flaccida. The pars flaccida is crossed internally by the chorda tympani. This part is more liable to rupture than pars tensa. The membrane is held tense by the inward pull of the tensor tympani muscle, which is inserted into the upper end of the handle of the malleus. Now let's learn about the structure of tympanic membrane. The tympanic membrane is composed of three layers. Number one is the outer cuticular layer of skin. Number two is the middle fibrous layer made up of superficial radiating fibers and the deep circular fibers. The circular fibers are minimal at the center and maximal at the periphery. The fibrous layer is replaced by loose areolar tissue in the pars flaccida. Number 3. The inner mucous layer is lined by a low ciliated columnar epithelium. So here you can appreciate the tympanic membrane and this right here is the malleus. Now, to understand, this is the pars flaccida, and this right here is the stretched pars tensa. This is the chorda tympani, and this is the facial nerve. This is the short and the body processes of the incus. This is the head of the malleus, and this right here is the handle of malleus. Again, pars flaccida, the handle of malleus, and as I told, this is the superficial radiating fibers, and these are the deep circular fibers. Let's move on. Blood supply. So, the outer surface is supplied by the deep auricular branch of maxillary artery. The inner surface is supplied by the anterior tympanic branch of the maxillary artery and also by the posterior tympanic branch of the stylomastoid branch of the posterior auricular artery. Now, venous drainage. Veins from the outer surface drain into the external jugular vein. This is the external jugular vein. Those from the inner surface drain into the transverse sinus and into the venous plexus around the auditory tube. Lymphatic drainage. Lymphatics pass to the preauricular and retropharyngeal lymph nodes. Nerve supply. Number 1. The outer surface. The antero-inferior part is supplied by the auriculotemporal nerve. This is the auriculotemporal branch, and the postero-superior part by the auricular branch of the vagus nerve with the communicating branch from the facial nerve right here. This is how the outer surface is supplied. Now, number 2, which is the inner surface. This is supplied by the tympanic branch of the glossopharyngeal nerve through the tympanic plexus. Clinical anatomy. Number 1. As already stated, for examination of the meatus and the tympanic membrane, the auricle should be drawn upwards, backwards, and slightly lateral. However, in infants, the auricle is drawn downwards and backwards because the canal is only cartilaginous and the outer surface of the tympanic membrane is directed mainly downwards. Number 2. Boils and other infections of the external auditory meatus cause a little swelling but are extremely painful due to the fixity of the skin to the underlying bone and cartilage. Ear should be dried after head bath or swimming. Number 3. Irritation of the auricular branch of the vagus in the external ear by earwax or syringing may reflexly produce persistent cough called ear cough, vomiting, or even death due to sudden cardiac inhibition. On the other hand, mild stimulation of this nerve may reflexly produce increased appetite. Number 4. Accumulation of wax in the external acoustic meatus is often a source of excessive itching, although fungal infection and foreign bodies should be excluded. Troublesome impaction of large foreign bodies like seeds, grains, insects is common. Syringing is done to remove this, as you can see right here. Number 5. Involvement of the ear in herpes zoster of the geniculate ganglion depends on the connection between the auricular branch of the vagus and the facial nerve within the petrous temporal bone. Number 6. Tympanic membrane is divided into an upper smaller sector which is the pars flaccida, bounded by anterior and posterior malleolar folds, and a large sector called the pars tensa, which are tensor or stretched. Behind pars flaccida lies the cauda tympani, so disease in pars flaccida should be treated very carefully. Number 7. When the tympanic membrane is illuminated for examination, the concavity of the membrane produces a cone of light over the antero-inferior quadrant, which is the farthest or deepest quadrant, with its apex at the umbo. Through the membrane, one can see the underlying handle of the malleus and the long process of the incus. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.